Stroke science continues to evolve at a rapid pace, driving new approaches that can change patient outcomes in a matter of minutes. The 8th annual Oman Stroke Conference held in Muscat brought Omani specialists and international experts from leading institutions to strengthen knowledge and improve regional stroke care.
This conference, we have 32 speakers coming to us from different parts. We have speakers from Harvard, from Johns Hopkins, from Calgary, and other universities as well. And in this version, we're actually focusing also on the robotic advances in terms of the treatment of stroke patients.
I'm mostly talking about bleeding in the brain. So that's a different kind of stroke where a blood vessel rupture and blood accumulates in the brain. So I'm talking about how we can manage this, how we can help people recover better and improve, and how we can prevent it.
The conference sessions focused on stroke early diagnosis, emergency response, rehabilitation, and emerging technologies such as robotics and artificial intelligence.
I will speak about PFO, which is a disease of young patients. They tend to have a stroke because there's still a passage in the heart from the right side to the left side. And it's something that we can treat by micro treatment by cardiologists. So very important to diagnose and to treat these patients after a stroke. Young physician needs to be aware that the PFO exists. They have to exclude all other causes before treating it, because it's a rare disease. So you have to do a good diagnosis and then refer your patient to the cardiologist to close it.
The focus of this conference, what I am speaking is about the disease which causes stenosis in the brain and the stroke, and the awareness that people take more and more measures to get aware about how to prevent the stroke.
This year's edition of the conference included the formal launch of the Asia-Africa Stroke Summit, supported by new agreements aimed at expanding training, research, and regional collaboration. The knowledge shared at the conference will flow into clinics and hospitals across the region, empowering medical teams and raising recovery prospects for stroke patients. Reporting from the Governorate of Muscat, this is Saleh bin Khalfan al-Rahbi.
And now to learn more, joining us now is Dr. Amal Al-Hashmi, a senior consultant neurologist, founder and the president of the Oman Stroke Society and chairperson of this conference. Doctor, thank you for being with us, Dr. Amal.
It's my honor and pleasure.
Thank you very much. Dr. Amal, before we talk about the conference outcomes, could you explain in simple terms what a stroke is? And then tell us what you consider the main highlight of this year's event.
Yes, sure. So stroke is a vascular neurological disease that is characterized by sudden loss or arrest of particular brain function. It is considered to be the second leading cause of death worldwide and third leading of disability. In this version of our conference, the focus was on the use of artificial intelligence in the diagnosis and the treatment of different stroke subtypes, but also a focus was on the role of robotics on the rehabilitation stage of stroke care. This conference version also held multiple debates in the gray zone areas that multiple research is needed in the future.
Now, how would you describe Oman's current progress in stroke awareness prevention and early intervention, especially among the general public?
I believe there has been a significant evolution in stroke care overall in Oman. Whether we are talking about the intervention perspective of it or the prevention, however, I think there is still room for future improvement.
And finally, what would you say in particular, especially about the 8th edition this year, whether in scientific content, participation, or its expected impact?
So, Mr. Abdullah, with no doubt, this conference has been and will remain a great platform for collaboration, exchange of knowledge among the experts in the field of stroke. We had 32 different speakers coming to us in this version from different parts of the world, including Harvard Medical School and Johns Hopkins and other universities as well. But this version considered to be a significant milestone, as we have signed numerous of MOU with regional and international stroke bodies and organizations. And we also launched a new Omani brand called Asian African Stroke Summit that will be hosted next year in Oman, and Egypt will be the host country for the second edition of it in 2027, followed by Iran.
Congratulations for that. But before we leave you, we would like you just to highlight what are the signs and symptoms if someone is really suspecting to have a stroke or is going to have a stroke. If you could just brief us on that before we leave you.
Yes, sure. So stroke is considered to be a broad spectrum syndrome, which the signs and symptoms depend on the particular area of the brain that can be affected. So at times it can be demonstrated by sudden loss or arrest of speech or language, or sudden onset of difficulty with movement, orientation, or balance or sensation.
Well, thank you very much, Dr. Amal Al-Hashmi, for your valuable insight and for your continued efforts in advancing stroke care in Oman. We wish you and the Oman Stroke Society every success, and we look forward to the outcomes of this conference contributing to better health for all. Thank you once again.